Informal workers are the backbone of Cambodian economy. They are street vendors, market traders, construction workers, transportation workers, white speaker, domestic worker. Whether working from home, the street, agriculture field, or external workplaces, they are subject to poor and unregulated working conditions and face high employment vulnerability. Among Cambodia's poor, informal workers are especially vulnerable to high risk and sensitive to unexpected health-related expenses.
iLab Southeast Asia is a local run innovation lab. We work collaboratively with our partners, local and regional, to look into the design solution that can help to address the social need, the social gaps that we met. Through the Rockefeller Foundation funding, iLab Southeast Asia have opportunity to look into the potential solution design to address the health need of the informal workers. We started by our field research, conducted interview with the informal workers. Followed by that, we have organized a regional workshop, prototyping workshop, which we include the key stakeholders from local as well as some of the partners from the regional to work together in looking to potential different options of the solution design that address the issue that we found earlier. We have been working on the two key prototypes, which is one is to improve the awareness raising, which is one of the big gaps that we've been hearing. And the second option prototype is to improve the registration and the payment of the re-enrollment for the insurance, micro-insurance scheme.
In November of 2014, health and informal worker representatives from Cambodia, Vietnam, Thailand, India and Bangladesh gathered at the iLab Southeast Asia to spend 2.5 days reviewing the most pressing health needs of informal workers, coming up with the new innovative ideas to meet those needs and rapidly prototyping initial versions.
បញ្ហាសុខភាពវាគឺជាបញ្ហាចម្បងរបស់ប្រជាពលរដ្ឋទូទៅហើយយើងចង់ឲ្យប្រជាពលរដ្ឋហ្នឹងគាត់ចេះប្រើប្រាស់នៅសេវាធានារ៉ាប់រងសុខភាពសម្រាប់ទាំងអស់គ្នាយើងដឹងថាប្រជាពលរដ្ឋខ្មែរយើងគឺជាប្រជាពលរដ្ឋដែលស្ថិតនៅក្នុងភាពក្រីក្រឬនៅលើភាពក្រីក្របន្តិចបន្តួចទេអញ្ចឹងយើងត្រូវការសេវាធានារ៉ាប់រងមួយដែលមានតម្លៃទាបសម្រាប់ពួកគាត់
When we talk about social health protection, awareness in order to transform the negative behaviors into positive behaviors in seeking health behaviors is a huge gap, and it addresses the gaps. And the solution that plan to develop, for instance, to ease the payment process, registration process, as well as complaint and feedback mechanism, it would be very, very helpful for the prospects.
In the refinement phase, we will focus working with the key stakeholder from the previous phase and look into the detailed design and prototyping. And we also taking this opportunity to conduct the rapid field prototyping and testing in order to validate this prototype solution in details with the end users.
Technology is something which is pretty much new for us at this point because we've not used a lot of technology. And it was interesting to know how technology can be used in sharing information, in increasing access to facilities, and how you could increase the number of informal workers' use of insurance and other services. I'm going to take back a lot of this learning and try to see how we can adopt it to the Indian context because yes, of course, a lot of the scenario was the Cambodian informal sector, but I'm sure it's kind of same and we will be able to take this opportunity back.
In the refinement phase, Instead, the iLab engaged partners from around the world to explore the possibility of replicating in other geographic contexts. This exploration included a month-long residency at the iLab Southeast Asia by a medical doctor from Uganda.
My 3 weeks placement here at the iLab in Cambodia has been a very productive time. I've learned quite a lot in terms of rapid prototyping. The situation for informal workers in terms of health and social support is the same both in Cambodia as it is in Uganda, and there is a lot I've learned in terms of how to quickly take a solution to the community and understand what doesn't work and bring it back so that you can quickly improve it. The experience learned here is very practical in Uganda. The technology is simpler. It does not require anyone having learned anything technical in terms of managing, let's say, the voice platform, and the use of telephone technologies in managing health microinsurance is very practical because of the extensive phone coverage in Uganda and the use of rated services already on the market.
At the end of the prototyping for Health of Informal Worker initiative, instead, the iLab will share final prototype design and the lesson learned while creating them. The prototypes will then be assessed, further refined, and piloted in hope of scaling nationally in Cambodia and into other communities around the world.